Hey, everybody. Thanks so much for joining us for another episode of Health Matters. And today we are going to be talking about vaccines. Of course, we know that vaccines are one of the most effective ways to protect our health and prevent serious illness and, of course, keep our community safe. And as of late, vaccines have come under a lot of controversy with a lot of changes that have happened at the federal level. But we do know that they continue to play a vital role in keeping all of North Carolina safe from flu shots to RSV protection and the latest COVID-19 vaccines. And as always, we are so excited to have the Secretary of the Health Department for Health and Human Services for North Carolina, Dr. Dev Sangvai, joining us. So glad to see you. How are you?
I'm doing well. How are you?
I'm doing good. Before we get started, last time we talked, you were in a sling. How's the arm going?
The arm is great. Thanks for asking. I had to wear that sling for about 8 weeks, but the most important thing after you get shoulder surgery is PT, so focusing on that.
Just focusing on that. Okay, glad to hear that you're doing well. Let's
Thank you.
kind of dive right into this issue of vaccines. First of all, just talk a little bit about why vaccines play such an important role, a critical role in health and well-being for people in North Carolina and just in general.
Yeah. Well, we've known, like you said, that vaccines are one of the best tools that we have to prevent illness. And particularly as we're getting into today is October 1 when we're filming, and as we're getting into what's the peaking up to the top of cold and flu season, it's incredibly important to ensure that if you can treat yourself or prevent yourself from getting an illness that's otherwise vaccine preventable, it's a good idea to get that vaccine.
What are some of the important ages for people to get vaccines? Kind of just overall, we're talking infants, teens, adults, of course, and to stay current with their vaccines.
Yeah, that's a great question. There are a lot of vaccines that are out there, and each and every one has proven efficacy. So one of the most important things is to make sure that you're getting the right vaccine at the right stage in life. We often focus on children, infants, early in life because that's the best time to get that immunity. We call that conferring immunity, but also focus on the elderly population as well. But then when we think about some of these it's one of those things that you really want to focus on an annual basis.
We talked about, you mentioned very briefly the flu, but we're in that season now where we start
Oh,
talking
yeah.
about flu and other kind of illnesses. So let's kind of walk through what's recommended for people to get vaccines, the age group, and what those vaccines would be.
Sure. So when it comes to flu, really anybody 6 months and older can get the flu shot. There's a variety of different flu shots out there, and it's really important that you talk to your healthcare provider, particularly if you're at higher risk or you have other health conditions where you have to think a little bit more deeply about what vaccine to get when, particularly if you've got someone who's got problems with immunity or immunocompromised. But generally speaking, for the average population, an annual flu shot is an important thing. And the reason we do it annually, Rod, is that every year the strains of flu are different. And so it's really important to make sure that you're getting the best vaccine for the most prevalent or the most common strains of flu that we see out there.
So the elephant in the room for a lot of people is there's a lot of chatter about whether vaccines really are necessary, whether they do work. How do you alleviate some of those concerns and those
Sure.
fears?
Yeah, that's another important thing. Shared decision making is really important, and it's really important to have the best information possible when you're making those decisions. So one of the things we really push for, that I really push for, is have a conversation with your healthcare provider about what vaccines are right for you. And then if you choose to get the vaccine, move forward with getting the vaccine. And some of these are going to be on a schedule. So you may need to get a particular vaccine at a particular age and then the next dose, or sometimes we call that a booster, at a later age. But it's really important to understand what makes the most sense for you. And then when you're dealing with some of these more common things that you see on a seasonal level, because they are more common, because they're more prevalent, you can even go to a pharmacy and have that conversation with a pharmacist to ask, is the flu shot right for me? When should I get it? And similarly with the COVID vaccine as well.
So let's talk COVID-19. I know the FDA has had some new COVID-19 vaccine formulations. Who's eligible now to get a COVID vaccine, and how do you get it? I mean, it used to be that you just said you wanted it at a pharmacy and they just popped it right in your arm when they could. Is it different now?
It's a little different, and it's really important to follow this on a day-by-day basis because there's a committee out there called ACIP, the Advisory Community for Immunization Practices. They're typically the ones who make the recommendations, and then they're adopted by a variety of different agencies, including the CDC, and even some North Carolina laws make reference to ACIP. Where it stands today, and this could change by the time this actually airs, is if you want to get a COVID vaccine, and you can go to a pharmacy and get it. We have implemented what's called a standing order. The state health director has implemented a standing order that anyone who is eligible, that's anyone 18 and older who wants to get the COVID vaccine that meets the criteria, can go ahead and get one without a prescription. So what that's allowed us to do is really bring access more closer and to bring access more readily available. Our goal is to make sure that if anyone out there wants to get a vaccine, we want to remove any of the barriers out there that may be there in order to get the vaccine. We still want to be completely compliant with the FDA, with the CDC, and any other authority out there that's involved in this space. But fundamentally, if someone wants to and chooses to get a vaccine, we got to figure out what's the most efficient way for them to be able to do that.
And I mean, we're talking specifically North Carolina, but this really kind of varies state to state on how states handle it.
It does. Yeah, different states handle it differently, mainly because they may refer to those ACIP practices differently in their statutes and their laws.
How has this caused a lot of confusion for people? Because I could imagine people don't know really what to do. And like you said, it
Right.
kind of changes day to day.
Yeah, I'll tell you, the confusion has actually been less. Since we
Well, that's
implemented the
good.
standing order for COVID, it's gotten a lot easier because what we basically did is replicated what we're able to do years ago, which is if you wanted to get a COVID vaccine, you could go to the pharmacy and get a COVID vaccine. And for a short while, there was a bit of a hurdle with requiring a doctor's prescription. What the standing order does is that it's in place of a prescription in some ways. You still need to be eligible to get the vaccine, but then you can go to the pharmacy and get it. And I'll tell you, after we passed that standing order, the number of thank yous that I got from patients, providers, and pharmacies for us removing some of those barriers, pretty impressive. We've immunized over 60,000 individuals
Oh,
who are
that's
choosing to get
fantastic.
vaccinated for COVID through the standing order. So it's working. Now, as ACIP changes its guidelines, as the CDC gets involved, if they change some of those rules, we may not need the standing order anymore. But it's there now as a way for if someone, again, if they choose to get the COVID vaccine, they're eligible for it. We're trying to remove all the barriers in the way for them to get vaccinated.
You guys got to stay on top of things left and right, don't you? Because
We
it
do,
just
and that's
changes so
just one
frequently.
of several vaccines out there, and as you said, there's just been a lot more attention on and focus on the issue right now. So it is requiring us to make sure that we're updated because we want to be the source of information. We want to be the source of clear, concise, factual information. Because if the healthcare providers and the pharmacists are confused, imagine if you're a patient out there.
Yeah.
Imagine if you're someone who says, "Do I get it? Do I not get it? Can I get it? Can I not get it?" And so our responsibility as an agency is to make sure that we can provide the most clear, concise, timely information so people can make that best decision for themselves.
Does that kind of hold true for MMR as well?
It does. MMR is a little bit different because there's a pretty strong schedule for that. Typically, you get your first dose of MMR between 12 and 15 months,
Hmm.
and the next one between age 4 and age 6, that booster, if you will.
Hmm.
Pretty good evidence that, in fact, solid evidence that the MMR vaccine works. But since it's not a seasonal type vaccine, those are ones where it's probably more important to have that conversation with your healthcare provider. Should I get it? When should I get it? And so forth.
Yeah, absolutely. What lessons did we learn from last year in terms of the illnesses and how many people became sick and there were a lot. It seems like there were a lot of respiratory illnesses that
Oh, yeah,
happened,
most
and a
definitely.
lot of them didn't. They weren't even flu. I got really sick at one point, and I went to the doctor, and it wasn't the flu, and it wasn't COVID. It was just like a respiratory illness.
Yeah.
What lessons did we learn last year
Yeah.
in terms of the number of people?
That is a fantastic point to bring forward. We talk about viruses like the flu virus, like COVID and RSV, but there are dozens, maybe even hundreds of viruses out there that can cause these cold and flu-like symptoms. The vast majority of those are mild and what we call self-limited, so they sort of stay within the individual, and the individual gets better over a couple of days. Things like RSV, where the illness can be more significant, we focus on that because you can get multiple viral infections at the same time. And so, if you get an RSV infection, for example, and then you get, we may call it a generic cold virus, it can make those symptoms worse. What we've learned is that vaccination works. And what we've learned is that vaccines work in a variety of different ways. For a large number of individuals, they prevent you from ever getting ill. That's the best case scenario. But in other cases, what it allows is if you do get ill, it shortens the duration of your illness and can sometimes even decrease the symptoms that you have. And then importantly, for these diseases that are a little bit more, that are spread more readily, it can also decrease your ability to spread it to others. And so you may have heard terms that we use, things like herd immunity and other things like that. It's your way of sort of being able to help the public while taking care of yourself.
And that was a huge misnomer when the COVID vaccines first came out, is that people thought you take the vaccine and you wouldn't get COVID, but that's not the case. It doesn't prevent it. It just makes it, a little bit more palatable, right?
Right. And in some cases it can, but that other issue is we need to get to that critical mass of individuals so you actually suppress the presence of the virus in the community, because that's the best way to prevent yourself. And let's not even have the virus in the community. And one of the ways you do that is to not spread it person to person. And by getting vaccinated, you're able to kind of achieve that.
So I talked about last year. I'm just curious, what has it been like so far this year? I kid you not. I think everybody in that room got sick at some point in our newsroom. And it was just, at one point there were probably for us 7 or 8 people out because it moves so fast and we're in such close quarters. Has it been really a rough season so far already?
Yeah, we're starting to see that it is definitely cold and flu season. We're starting to see a slight uptick in a variety of these respiratory illnesses, including COVID. And so not surprising. Because again, it is that time of year where individuals tend to be quartered closer together. Individuals tend to be more indoors. That's just going to lead to the spreadability of these infections. So we're starting to see that uptake. The concern, of course, is if it gets worse, then it puts more pressure and strain on the healthcare system because it's sometimes hard to get appointments. If it's sick enough, you're getting to the emergency room. So this is where prevention really matters.
Yeah, I'm not going to lie. I kind of wanted to come in here in a hazmat suit at one point because it was so many people sneezing and coughing and saying, like, what is going on in here? But it doesn't take long for it to pass around to folks.
Sure.
We're going to take a quick break. And when we come back, we want to talk about a great program that you guys kind of just kicked off. And that's the Test to Treat initiative for flu and how North Carolinians can get protected this season. So hang with me for just a second. We'll take a quick break. We'll be right back in just a minute with more on that. All right, everyone, welcome back to Health Matters. Glad you can stay with us. Today, we're talking once again with Dr. Dev Sangvai, who is the Secretary of the Department of Health and Human Services for the state of North Carolina. Thanks so much for being here once again.
Of course.
A quick question. So you guys kicked off a program, I think it was, as of the taping, I think it was just a few days ago, maybe on Friday, called the Test to Treat Standing Order for Flu. Tell me a little bit about what that is, first of all.
Happy to do so. So I mentioned earlier, we talked about the ability for the state to issue standing orders in the COVID-19 vaccine example. This is in some ways similar. So the state health director has issued a standing order that a pharmacist now in North Carolina can do testing for flu. And if the individual who is being tested, in fact, tests positive, can offer treatment for the flu as well. What this is really doing is, again, bringing access to individuals who need to get tested. Let's imagine if you're symptomatic, you think you have the flu because you've got a fever or you've been exposed, you've got body aches. You go to the pharmacy, the pharmacist tests you, usually with the nasal swab, and if it comes back positive, then you have the ability to get treatment. And you might be saying, okay, well, what's the treatment? We know that in many cases, the best treatment is to get plenty of fluids, rest, to take the right medicine if you've got a fever. But also there are some antiviral medications that are available that if an individual takes them early enough in the course of flu, it does a lot of what we talked about earlier. It reduces the symptoms, reduces the duration, and may also reduce the level of infectivity you may have for others. So this is something we do at the doctor's offices. I used to do this all the time when I was practicing medicine. But that barrier of going to a doctor's office, getting an appointment, we're trying to remove those barriers again. And this is one way to bring treatment closer to the patient.
Why is this? Why is this so hugely important? And the second part of that question is this something that's kind of unique? Is this the first time it's ever been done?
Let me answer the second part of your question first. It's a little bit unique in the sense that we're bringing healthcare closer to the patient. But there have been other examples where we've used the power of the pharmacies to help us make sure that patients can get access to the care that they want. It's important because we know that flu can be pretty devastating. It still is one of the leading causes of ED visits this time of year. It's one of the leading causes of the terms we like to use in healthcare is morbidity, which is our fancy way of saying, sick. And it's also a leading cause of mortality. People still actually can have flu bad enough that it can lead to severe consequences. So again, the best thing to do is to practice good hygiene so you don't get exposed to the virus. If you do get exposed to the virus, having the vaccine and having gotten the vaccine is one way to prevent from getting flu, and certainly a way that if you ultimately do have the flu, to not have the symptoms be as bad as possible. And then finally, if your symptoms are ones where treatment matters, you can go to a pharmacist. They can do the testing and they can offer the treatment. And the treatment is either comes in the form of a nasal spray or pills.
And I know we talked. The pills are great. I'm one of those people. I'm not a big needle fan. Is that a big issue for a lot of people that they're just still very afraid of the needle? I mean, maybe I'm just not strong enough in that sense. But every time
Sure.
I turn my whole head and body around.
Yeah, I mean, there are individuals who still don't like the idea of needles, and so here we're talking about the actual vaccine, and so you can actually get an inhaled version of the vaccine as well. But the treatment is also available as pills or an inhaled form. So treatment less in the form of an injection or a shot, but definitely the vaccine.
Yeah, I'm sure people would love that. Love not having to get a shot. I know we talked about this, but I like to keep. It almost feels like I'm having you repeat yourself, but I think it's important information for people who may have missed it. Where can folks get the flu shot in North Carolina? Where can they get COVID shots?
Absolutely. So your healthcare provider is a great place to go for both of those. We can now get those at most pharmacies, both the chains as well as the independent pharmacists. Local health departments offer it. And then be on the lookout for pop-up clinics, flu clinics, and even COVID clinics that may be opportunities to get the vaccine in those settings. Again, it's your choice to get the vaccine. You got to be eligible to get it, but these are places that you can get it that once you meet those two criteria or achieve those two criteria, can give you ease to vaccination.
And for people who are still hesitant, about what to do and a little bit unsure, what are you guys doing as a health department to kind of alleviate some of those concerns? And how do you get people to look at it and do it?
Yeah, that's a really good question. There are a couple ways to look at it. I think we have to be prepared, and you and I have talked about this a little bit in the past, is that having the decision, engaging in that shared decision making is not sometimes a one and done conversation.
Yeah.
You may have to have that conversation twice or three times. It can be time consuming. We know that. And it can be one of these things where you might be having the exact same conversation multiple times. But individuals have to be comfortable that they're making the right choice. And so I feel like at that individual level, be prepared to engage in shared decision making, not just once or twice. From an agency perspective, it's our responsibility to make sure that we provide the most accurate, timely, clear, and concise information, and where there are barriers to individuals who choose to get vaccinated, removing those barriers.
Is there anything down the line that you guys are working on to try to encourage more people? Any new programs that you want to preview?
Yeah, I mean, I think, right now, still very much, it's October 1. We're just in that peak of flu season. So really focusing on individuals getting their flu vaccine and if they want to get their COVID vaccine as well, getting both of those at the same time. Because, we often talk about the three biggest risks on top of all those other viruses that might be out there. It's flu, COVID, and RSV. And so it's really important to, if you're vaccine eligible and you want to get those vaccines, we want to make sure you find a way to get them as efficiently as possible.
From just a doctor standpoint, are there any things that people can expect when they get a flu vaccine? Any side effects, or what can they expect to feel after?
Yeah, it's oftentimes people will say the flu shot causes a flu. It doesn't cause the flu. What happens
I've heard
is
that
that
for years.
right, right. One of the things is that you could get local soreness because it is an injection that you put into the muscle, but usually that's short-lived. Sometimes you get some mild flu-like symptoms, but you often treat that the same way you would with flu. Maybe a little bit of rest, making sure you get plenty of fluids. If you're feeling like you're not getting enough intake, if you have a fever, you can take an anti-fever medicine. But generally, that's much shorter lived, far less intense than the flu itself, and it doesn't happen in everybody. It's in the small minority of individuals who actually have those type of symptoms post-vaccination.
Yeah. All right, Dr. Sangvai, anything else you want to mention about getting prepared for the upcoming season and what we should expect and how we can all take care of ourselves so that we can take care of each other?
Absolutely. I appreciate you asking me that too, Rod, because, we've talked before that this is all in the context of living as healthily as you can. We've said health matters. So getting good sleep, getting good nutrition, getting right exercise, de-stressing whenever you can are going to be equally important because that sets up the right state for you to be able to fight infections, to get vaccines, and so forth. So it's really a opportunity to just think about what it means to live a healthy lifestyle and to be healthy in general.
Absolutely. Dr. Sangvai, thank you so much. Glad your arm's good. You can get back out
Appreciate
and play
it.
some baseball.
That's
I don't know
right.
if you play baseball, but I just like to make that joke. We appreciate you being here as always. And we're going to wrap up this episode of Health Matters, and we'll talk again with Dr. Sangvai next month. For viewers, staying current on your vaccines is one of the most important and really one of the most simple things that you can actually do. So please take care of your health. I'm Rod Carter, and this has been Health Matters. Stay healthy, and we'll talk to you again soon.